Hourly Comfort Rounding, why it's good for staff and patients.
Employees and physicians across Memorial Care are striving to give perfect clinical care and exceptional service to our patients. We do this because it's the right thing to do for our patients and their families. We know we're better than average, so how do we improve and how do we ensure our patients notice? The answer is service always.
Objectives for this course include 1. Describe hourly rounding, 2. Verbalize the importance of rounding on clinical outcomes, and 3. Verbalize the 8 key behaviors that impact the patient encounter and satisfaction.
I don't know why we're here. I don't even have time for this.
We sure don't. We could be doing other things.
Good morning, everybody. My name is Jamela. I will be talking about hourly comfort rounding.
Hourly comfort rounding is a process by which nursing staff check on patients on an hourly basis while demonstrating particular behaviors focused on anticipating patients' needs. Current nursing care is often reactive. Hourly comfort rounding is a proactive approach to patient care so that needs are met before they become a problem. Hourly comfort rounding has been shown to decrease patient falls, decrease call lights, builds trust and decrease anxiety for the patient, which increases patient satisfaction while also increasing staff satisfaction. There are 8 key rounding behaviors. Introduce yourself, title, and role within the healthcare team, perform scheduled tasks, address the 5 P's for the pediatric population, which stands for pain, potty, position, play, and possessions, address additional comfort needs, conduct an environmental assessment, ask, is there anything else I can do for you, and explain when you or others will return. Then document relevant assessments and interventions on the log or chart.
And that concludes our hourly comfort rounding. Are there any other questions?
Okay, so Aaron is a 4-year-old male. He's post-op day 2 of a lap appy. Didn't have any issues, but he does have a history of seizures. Plan is for him to go home today as long as he tolerates breakfast and lunch and is okay with just oral pain meds. Dad's at the bedside.
Okay, thanks.
Scenario 1. This is an example of ineffective hourly rounding.
Hi, my name's Vicky. I'm going to be your nurse today.
Hi, I'm Dan. This is my son, Aaron.
Okay.
I have a question. When will we be able to go home today?
Well, it all depends on how well he eats breakfast and lunch and if he needs any pain shots.
Well, the doctor said yesterday that after he had his appendix removed that we could go home today.
We'll see. I'll get back to you on that. Hi, Aaron. My name's Vicky. I'm going to be your nurse today. Can I just look at this? I want to see if this matches my paper. Do you have any pain?
I think he's a little afraid to say if he has pain because he's worried about staying here longer. And he's starting kindergarten. He's really excited and anxious about that.
Well, he looks good right now. I'll be back after breakfast to do his vitals and his assessment. Okay?
Okay.
Bye, Aaron.
How are you?
Not so great. I caught a flat tire this morning. Total medicine, just like a chicken with its head cut off.
Hey, Emily, I'm kind of hungry. Where can I get a bite to eat?
The cafeteria is down on the ground floor.
There you go, buddy.
Patient safety is always our priority. How could this have been prevented? Take an active role in preparing yourself to always provide the best and safest care.
And that concludes our presentation on hourly comfort rounding. Are there any other questions?
I have a question. Can you please review the 8 rounding behaviors?
The first rounding behavior is introducing yourself using opening key words. Include your name and your role in the healthcare team, and give the patient and family a rationale for rounds. For example, as part of our care, we have implemented hourly rounding. We no longer wait to be called, but rather anticipate your needs by visiting you every hour during the day and every 2 hours at night. This is called rounding. Also, make sure that the patient is aware of the rounding schedule. The second key rounding behavior is performing scheduled tasks. In most instances, there's no need to go into your patient room an additional time to conduct the rounds. Do them when you're performing your usual care. For example, medication administration, vital signs, dressing changes, changing IV fluids, teaching, or bathing.
Can you please clarify the 5 Ps?
In order to provide the best possible care to our pediatric patients, we need to address the 5 Ps, which stands for pain, potty, position, play, and possessions. In addition to asking your patient, "Are you having any pain right now?" also utilize developmentally appropriate pain scales. Examples include Wong-Baker faces, FLAC, NPAS, or numerical. The PCA should locate the nurse if the patient or parent indicates that the patient is in pain. The second P is for potty. It is very important to include this in every round. Ask your patient, "Can I assist you to the bathroom?" This also includes any incontinence care or emptying urinals. In order to promote teamwork and more efficient care, the RN should assist the patient to the bathroom without leaving to search for the PCA. The third P is for position. Ask your patients, "Can I help you to change position so you are more comfortable?" For patients requiring more assistance, utilize the lift team and one another to accomplish this. Plan to do your round at this time. The fourth P in pediatric patients stands for play. Play can minimize anxiety and builds trust between the healthcare team and family. Play is also used as a distraction technique or educational tool, and also promotes patient and family-centered care. The fifth P stands for possessions. Pediatric patients often rely on their favorite toy or teddy bear to comfort them while in the hospital. Ensure that the patient's possessions, when not in use, are placed in the closet or drawer for safekeeping. Provide a safe, tidy, and clean environment, and also make sure patients and families know where to locate their belongings. The fourth key rounding behavior is assessing for additional comfort needs. This can include straightening sheets, pillows, or filling water pitchers. If left undone, these simple unmet needs can lead to additional call-out requests. Next, conduct an environmental assessment. Do this by checking, is the call light or telephone within reach? Are personal possessions within reach? Are the light switch and TV control accessible? Is the trash can next to the bed? Is the bedside table within reach? And does the patient look comfortable, and is the patient covered to protect privacy? Then use closing key words and actions such as, "Is there anything else I can do for you?" The phrase is designed to engage your patients and elicit requests from the patient while you are still there. It is also very important to explain when you or others will return. For example, someone will be back in about an hour to round on you again. When you tell patients when you will be returning, they will begin to cluster the requests around your rounds. The final key rounding behavior is documenting the round on the log. Initialing the log validates your care and helps to communicate hourly rounding with your healthcare team.
I've heard something about AIDIT. What is this?
AIDIT ensures ongoing communication with patients and families and is essential always. AIDED stands for Acknowledge Your Patient, Family. Introduce yourself. Include the duration if applicable to explain what you are doing and how long it will take, and thank them.
Hey Emily, do you remember hearing about the no pass zone during hourly rounding?
Yeah, I did.
Okay, so what this means is anytime a call light goes off, any caregiver is supposed to go in, ask the patient and family if they need assistance.
Okay, sure. Let me see how can I help.
Okay, thanks Emily.
You're welcome.
Scenario 2. This is an example of effective hourly rounding.
Making their way through a huge pile of shellfish. Allison will
Hi, good morning. My name is Vicki. I'm the RN that's going to be caring for her son today. I'm working with Emily. She's our PCA who will also be helping me today.
Hi, I'm Dan and this is Aaron. Thank you.
Hi, Erin. How are you? My name's Vicki. I'm going to be the nurse caring for you today, okay?
Vicki, I was wondering, when would we be able to go home today?
Well, it all depends on how well he eats breakfast and lunch and if he requires any pain medication.
Okay, he's starting kindergarten soon and he's pretty anxious about it, and we did miss our orientation on Thursday. So.
Oh, I can understand. Well, we'll see how the day goes, okay? Let me look at your armband, honey. Dan, I just wanted to point out the yellow wristband on his arm here indicates that he's a fall risk because of his history of seizures. That also tells us he has a risk for falls. So we don't want that to happen. If he needs to get out of bed or anything, please give us a call and we can come help you.
Absolutely, that's great.
Hey, Aaron. Do you have any pain? I just want to know that you're comfortable, okay? I want you to see the happy face and then see the sad faces. Can you point to the face that tells me how you feel? Like that one? Okay, thank you. Aaron, do you gotta go potty? Do you gotta go pee-pee? You're good? Daddy, do you think he needs to go pee or anything?
No, I think he's okay.
Okay, just let me know. Are you comfortable? Do you want me to scoot you up in bed a little bit?
Yeah.
Yeah? Okay, here, I'm gonna scoot you up a tiny bit. Let me put the pillow underneath your head. And is Mr. Snuggle, is he close enough to you? Is he okay right there? I'll be back in about an hour after breakfast. I'll come back and do his vital signs and his assessment.
Sounds good.
And also, I think I'm going to call Child Life. They're really good with helping the patients ease their anxiety, so they can come talk to you guys and get them prepared for kindergarten, okay?
Wonderful, thank you.
Here's the call bell. Hit it if you need anything. Like I said, I'll be back in an hour. Is there anything else I can do for you?
No, we're good. Thank you very much.
Okay, see you in an hour.
We'll see you.
Hi.
Hi.
My name is Emily. I'm going to be your PCA for today. I have Aaron's breakfast tray. Would you mind if I help him with breakfast?
Not at all.
Is there anything, do you mind if I tidy up your room?
That would be great, thank you.
Is there anything else I can do for you?
We're okay, thank you.
Someone will be with you in about an hour. If there's anything else you need before then, please use your call line.
Okay, thank you very much.
You're welcome.
Never underestimate the difference you can make. Hourly rounding is your opportunity to make a difference in your patient's care 1 hour at a time.
Every day I have the opportunity to witness many of you in action, and I am so impressed by the care and diligence you convey to our patients and their families. By being proactive with hourly rounding, we can further enhance our culture that is dedicated to patient safety and patient satisfaction. We are a patient and family-centered care organization at our heart and at our roots. We are premier organizations. We are premier hospitals in Southern California. And it is because of your activities, your relationships with patients and their families that is at the heart of this. Thank you for all you do.
Bye, Aaron. See you later.
Bye.
Bye.
Have a good day, Aaron.
Bye, Aaron. Take care.
You always determine your role in patient care. Which scenario reflects your care?